in.
Hi, Mr. Tecchio. How are you?
Well, how are you?
I'm good. So I'm Lindsay. I'm your nurse. I'm just going to go ahead and do a quick physical assessment. Can I just get you to tell me your name and your birthday?
Paul Tecchio, February 17th, 1990.
Perfect. Any allergies to foods or medicines?
No.
Okay, so like we discussed in our previous meeting, when we went over your health history, we're going to go ahead and do your physical assessment. So basically all that means is I'm just going to do a head-to-toe assessment. I'm going to be asking you some questions, asking you to do some funny things. I'm going to be feeling and listening to a lot of different areas of your body. If you have any questions, anything hurts, anything like that, feel free to stop me.
Okay.
Okay? So, do you have any questions before we get started?
Nope.
No. Okay, so the first thing I'm going to do, I'm going to look at your head, your eyes, your nose, make sure everything's equal, that like your nose is midline, your ears are set in a normal spot. I'm going to feel to make sure there's no like dips or divots or anything weird in your head. If anything hurts while I'm doing this, please let me know.
Okay.
Your ears are nice and equal, eyes are nice and equal and set on your face, nose is equal, mouth is good. Also, I'm going to kind of intermix a couple things. I'm going to test your cranial nerves while I'm up in your head area as well and ask you some questions, okay?
Okay.
Can you tell me what year it is?
It is 2018.
Okay, and who's the president?
Donald Trump.
Okay, and do you know where you are right now?
I'm at home in Washington, D.C.
Okay, so go ahead and look at my nose. This tiny little light is going to shine into both your eyes. I'm just testing to make sure your pupils are equal and reactive, okay? So just look right at my nose.
Oh.
Perfect. Perfect, okay. Pupils are nice and equal and reactive. Nope, a little tangled. Can I go ahead and get you to tip your head back just so I can look up your nostrils really quick? Good, and go ahead and stick out your tongue and say ah. Any dentures or false teeth or anything like that? No. Go ahead and give me a nice big swallow. Any difficulty with swallowing or anything like that?
Nope.
No? Okay. I'm going to get you to close your eyes. I'm going to touch different spots on your face to make sure that you can feel them equally, okay?
Okay.
Can you feel me touching there?
Yep. Yep.
Different or the same?
Same.
Okay.
Yep. Yep. Same. Yep. Same.
Okay, perfect. I'm going to go ahead, ask you to give me a nice big smile. Go ahead and frown. Smile. Show me your teeth. Good. Everything's nice and even. No facial droop or any, all symmetry looks good. Go ahead and shrug your shoulders up for me. Okay, and then I'm going to hold against and kind of give you resistance. Go ahead and turn your head to both sides for me. Try to turn. Good. And then turn your face, like look a different direction. Good. Good. Nice, good spinal cord. Looks good. Okay, I'm going to ask you to tip your head back just a little bit. I'm going to feel your trachea and make sure that everything's midline for that. Good. Nice center your trachea. I'm going to go ahead and look in your ears. Can you hear me okay?
Mm-hmm. Yep.
Okay. Can you hear me okay on this side?
Yep.
Okay.
Yep.
Good. Both loud and soft sounds you hear very well. I do need to do one smell test. So maybe close your eyes. I'm going to bring a couple things over. Have you include a nostril smell and then include the other one. Okay?
Okay.
So go ahead and close your eyes for me. You go over to my desk and grab a couple things. Alright. So go ahead and include your first nostril, whichever side you want. And tell me what you smell.
Coffee.
Perfect. And then with your eyes closed, go ahead and include the other side. And tell me what you smell.
Vanilla.
Perfect. Great sense of smell. That's great. Okay, so I'm going to go ahead and listen to your lungs and your heart. I'm going to make sure that you're not having any like difficulty breathing and that breathing's nice and equal. Have you had any trouble breathing, any shortness of breath, anything like that?
Nope.
No? Okay. Go ahead and take a nice big breath in for me. And out. Good. Again. Good. Good. I'm going to go ahead and listen up here. Your lung fields do go up pretty high. Good. Good. No accessory muscle use, which is good. Means you're not struggling to breathe. Okay. So I'm going to go ahead and listen to your heart, so just relax, take normal breaths. Most people don't really care about this, but I'm going to be listening to the first place is your aortic spot, which is your second intercostal space, the right side of your sternum, and then your pulmonic, which is the same spot just on the left side of your sternum, Your Erb's point is just one spot down. Your tricuspid. And your mitral. Awesome. All look good, and I'm not noticing any extraneous muscle use when you're breathing. Can I get you to sit forward for me just so I can listen to the breath sounds on your back? Perfect. Take a nice big breath in. Good. And again. Good. One more time. Last time. Good. Everything with that sounds good. Can I go ahead, we'll go ahead and do your abdomen and all that. Can I get you to lay down for me? How's your eating pattern been? You've been hungry, been able to eat, tolerating, no nausea or vomiting or anything like that?
Nothing abnormal.
Perfect. When was your last bowel movement?
Today.
Today? Everything normal?
Yes.
Perfect. No pain, no blood, nothing like that?
Nothing.
Okay. I'm going to go ahead and just look at your abdomen, make sure everything looks okay. We're nice and equal. Perfect. I'm going to go ahead and listen to all 4 quadrants, and then I'm going to go ahead and press. Okay? Just
Okay.
if you have any pain, just let me know.
Okay.
Got nice active vowel sounds, which is good. Good. Okay, I'm going to go ahead and press now. You tell me if anything hurts, okay?
Okay.
Okay.
Nope.
What about here?
All good.
Okay, and what about urinary wise? Are you having any pain or frequency?
Nothing abnormal.
Okay, what about the color of urine? I know that's kind of a weird question to ask, but everything looked normal with that?
Standard.
Okay, nice and clear, no
Yep.
cloudiness, or feel like you've got anything in your urine?
Nothing.
No? Okay, I'm gonna go ahead and palpate your bladder, okay? Make sure everything feels okay with that. Perfect, you can go ahead and sit up for me. I'm going to do a couple musculoskeletal things, just testing your strength. I'm going to get you to stand up, hop on one leg, all that kind of stuff. Okay?
Okay.
While I'm doing your musculoskeletal, I am going to go ahead and assess your pulses just to make sure that those look good too. Okay? I'm going to start up with your neck, with your carotids. Perfect, nice and equal. Definitely say they're about +2, which is normal. +1 is pretty thready pulses, and +3 is way too strong. Radial pulses are good. Ulnar pulses are good. I'm going to forego going to your femorals just because they're kind of in your groin area, which is uncomfortable for people. Popliteals feel good. Pedal pulses are good. Perfect, nice and equal. Everything looks great. Okay, so I'm going to have you stick your arms right out in front of you. Don't let me push down. Good. And don't let me pull you up. Perfect. Same thing with your legs. Go ahead and try to kick out. Good. Pull back. Good. And like with your feet, go ahead and try to push up towards the ceiling and down like you're pushing a gas pedal. Perfect. So I'm going to go ahead, get you to stand up for me with your hands by your side. Go ahead and close your eyes. This is just basically testing for your balance, make sure everything looks okay. It's just for 30 seconds. I know that seems like a long time, but perfect, you can go ahead and have a seat. Everything looks normal there. Oh, actually before I have you have a seat, go ahead and hop on one leg, whichever one you want to. Good, you can stop and do the other leg for me. Perfect, go ahead and have a seat. Any problems, any pain, joint pain, back pain?
Nothing.
Nothing like that? Okay, I'm going to go ahead. Your skin feels nice and warm. I'm just going to kind of pinch on it to make sure it goes right back down. Got good skin turgor, which is good. I don't see any rashes. Have you noticed any rashes anywhere that I haven't inspected?
No.
No? Okay. Do you have any questions about anything that we've done today?
No.
Okay. So I'm going to go grab a couple of materials, and based on what we talked about before your physical exam and what I found on your physical exam, everything looks great. But we're just going to go over some brief teaching and just kind of things to help improve your lifestyle, okay?
Okay.
I will be back in just a couple minutes.